All right, so just to give you some background on myself as well, I am a sociologist by training, and so my understanding and interest in HIV is really trying to understand how we address stigma in the South, is particularly with intersectional identities, like the intersection between race, ethnicity, and sexuality and health. And so a lot of the background that we, as Dr. Jones and I, bring to the table is really kind of bridging the gap between faith-based perspectives and thinking about how we address stigma around HIV and stigma around and kind of finding ways to accept and move forward the agenda of embracing all of our brothers and sisters in this fight against stigma around HIV and addressing health equity along the way. And so this is kind of the first funding. This is the first initiative that is focused on faith-based initiatives, particularly through Gilead Compass. And Gilead Compass has pledged $100 million over the course of 10 years to particularly support states and faith-based organizations in the South. And so this is an initiative for us to address that kind of gap that was being left out, was thinking about how to address this with faith-based organizations. So the center we have three kind of focus areas. One is on storytelling, thinking about how we can highlight and celebrate the stories of people living with HIV, people who are affected by HIV. So it doesn't necessarily have to be someone who's living with HIV, but all of us in the community who have been affected in some way. And telling those stories, talking about ways that we can address healing, address mental health, and the role of music and other kind of forms of kind of culture that are tied to, healing and faith and HIV and faith. So we at the center are going to be launching a podcast that features experts in those topics, as well as developing social media communication toolkits that faith communities can use to help educate their communities about HIV and faith. We are also going to be hosting trainings. These trainings will also cover similar topics, going deeper dive into biblical and spiritual trainings and thinking about trauma-informed care and how to set up and establish sustainable programs for health ministries, and to also provide connection to and develop some strategic partnerships with faith-based organizations throughout the South. And then the last and probably the most important part is our funding. So we are prioritizing funding of organizations that either work with faith communities and or are faith communities themselves. And so we have different levels of funding that I'm going to go into deeper. And each level of funding is to kind of get at, I guess, the different capacity building efforts around helping these organizations to address stigma in the South, HIV stigma in the South. Like we mentioned, Dr. Jones is the principal investigator. I'm the executive director, but we also are leveraging strategic partnerships with Wake Forest Baptist Health, with Faith Health NC, which is an organization that works with faith leaders in hospital systems and also works with community-based organizations to connect people to care. Atrium Health is now a strategic partnership with Wake Forest Baptist Health. So that covers North Carolina, South Carolina, Georgia, and Virginia. And then also trying to, through these funding opportunities, establish a regional partnership with faith-based organizations and communities across the South. So the first opportunity that we have is the Learning It Together cohort. So this is an opportunity for what we call executive level leaders who are interested in maybe that you've already done some HIV work or done some faith-based work, and you're interested in how you can expand that, increase the capacity of the work that you're already doing. And we as the Faith Coordinating Center have, we're committed to connecting these leaders to resources and strategic partnerships that can expand that, that can expand their scope and help them scale. And so these would be quarterly meetings with the cohort, and do deep dives into, building collaborative knowledge, expertise in particular topic areas related to faith and HIV, and strengthening those community networks so we can enhance those collaborations and expand the capacity of those organizations and those leaders to be able to do this work. So this is basically a 1-year commitment. We are with the application is already live on the website, gileadcompass.com, and you can see the actual URL is at the bottom of the slide. And Marcus, who is our project administrator, will also be sharing it in the chat, the link in the chat. So the application deadline is April 15th for this opportunity if you're interested in joining the cohort. And you would submit a personal statement and your resume for us to consider your acceptance into the program. The next opportunity that we have is the congregational partnership. So the congregational partnership is particularly focused on individual faith communities. And I want to also mention that we're taking an interfaith approach. So it's not just Christian, we're also thinking about, Muslim faith, Buddhist, Hindu, all of the, and the interfaith kind of non-denominational, right, approaches to thinking about developing programs and initiatives or conducting research in your local communities that promote positive faith and health outcomes, specifically in the area of HIV. So this funding is to increase the capacity for faith communities to address the social determinants of health, and also to participate in and disseminate the national communications that we provide to address HIV stigma in faith communities, for faith communities, by faith communities. We will also provide an additional $10,000 in consulting services. So if your organization needs help with expanding their capacity in some way, we can help identify consultants. And I think it would be useful in your applications for you to outline what type of consulting you think you may need to help do this work. Maybe it's consulting around the financial pieces of it, or consulting around community building, or consulting around establishing health ministries, or doing communications work. So the next one is a faith action grant that is similar to the congregational partnership, but the faith action is focused on nonprofit organizations who are in partnership with faith communities. So maybe the faith community is not necessarily ready to apply for funding independently, but you could partner with a nonprofit who could be the fiscal sponsor, and help with establishing or supporting action-oriented projects that are centered around faith to help reduce stigma and engage in spiritually integrated trauma-informed care, aid in changing the perception of HIV and AIDS in the South. So we purposefully made these categories kind of broad, but with some guidance, because we want to also leave room for the for you to be able to fit in the programs and initiatives that you're already doing, or that you could even be creative about pulling together for the application. So that, these are also, again, focusing on increasing the capacity to address social determinants of health. So social determinants of health include things like access to housing, transportation, mental health support, food insecurity, addressing, trauma-informed care, connections and linkage to healthcare, right? So any kind of, and education, right? And so any kind of infrastructure related issues that make people vulnerable to HIV would also fall in that category. Then we have the transformative grant that is one of our larger grants that is aimed at supporting the establishment of infrastructures and programs to enhance access to employment, education, transportation, housing. So maybe you're a larger organization or you work with multiple faith communities, and this money will help support and increase that infrastructure to be able to do that work, particularly living around in, particularly serving people, at risk for or living with HIV. So we're really trying to focus on creating inclusive faith spaces, either virtual or in person, for people who are LGBT or people living with HIV, creating opportunities for physical and emotional and financial wellness, and educating faith leaders also. So say maybe you have an organization that primarily works with faith leaders and training them, and helping increase their capacity to address and be able to respond to HIV/AIDS in the future. Lastly, our largest funding opportunity is the capacity building grant. So you can tell that there's kind of common themes across all of these, but this capacity building grant is for large organizations that work with, the grant applications that will be strong for this funding opportunity will be those large organizations that work with maybe multiple states or multiple organizations, faith-based communities. And so they are able to demonstrate that they have a very large impact in addressing HIV/AIDS in faith communities across the South. So the idea and the hope is that we'll have an impact, to increase training for people, for faith communities to address and educate others about HIV stigma, using community engaged and trauma-informed strategies that will be able to increase their capacity to address social determinants of health and to have that coordinated national communications effort. So the submission details, you can go to gileadcompass.com. So now I'm going to go into the nitty gritty. That was just kind of a broad overview of the funding opportunities. And so now I'm going to go into the details about submission deadlines and eligibility criteria and that kind of thing. So what makes a strong application? We want to see that you can clearly articulate how your project will address people living with HIV or who are impacted by HIV. We want clear outline of how you're going to what the plans are to deliver the program. What maybe if you have some experience with doing some of this in the past, provide some background so that we have a little bit more information about your organization. And what work you have done in the past. And it's okay if you have never done this in the past, but maybe you are maybe you're an HIV organization that is establishing more faith-based connections. That's great. So you highlight your HIV work, and then that you are establishing a relationship with the faith-based organization, or maybe you're a faith-based organization that's done some social determinants of health type work, health equity type work, and you want to add in the HIV component. So make the case that you've done that, and then that you are using this to build your capacity to do HIV work. So those would be good ways to demonstrate your kind of fit for the funding. And we also don't want you to think too small, right? It says up to 15,000, but we really want to encourage organizations to go for that 15,000 or go for that 25,000, go for the 100,000, right? We don't want you to do grants that are really less than that. We want to fund as much as we can and support these grassroots efforts. And so, and we also want to see sustainable programs. So programs that you are establishing that will last beyond the length of the grant. Maybe, and part of the goal of the program, the center, is for us to also make those connections with you and connect you to other funding sources so that those programs can be sustainable. But we do want to see that there is a commitment and a plan for making these programs and initiatives sustainable. And we're not necessarily interested in supporting one-off events like a conference, but we want to see something that's going to have an impact in the community and be long-term. So in general, everyone needs to be a 501c3. You have to provide proof, or you need to be like a letter showing your 501c3 status, or be connected to a nonprofit organization that has 501c3 status and will be your fiscal sponsor. Your initiatives need to be concentrated in these 12 Deep South states. Although your organization, may have a headquarters in another non-Southern location, but just you need to demonstrate that you are doing the work in the South and have connections to organizations in the South for your application. And so Alabama, Arkansas, Florida, Georgia, Kentucky, Louisiana, Mississippi, North Carolina, Oklahoma, South Carolina, Tennessee, and Texas. And so all of the grant applications are due May 1st, and we will award notifications June 1st, with all of the plans for the work to begin July 1st. And with the exception of the transformative grant, the $100,000 level, the grant cycle will be July 1st to June 30th. So it's a fiscal year. And the funds must be spent by June 30th. So for the congregational partnership and faith action grants, these are I mentioned this before, the grant cycle dates. You will also be required to submit quarterly reports and mid-year reports and a final report. And so those reports will include questions about what impact has the funding had in your community, demonstrating how many training workshops that we have facilitated that you have attended, how many people are you engaging with, who are the other organizational partners that you've conducted, that you've worked with, and where, just demonstrating the impact of the funding that you have received. If you have received funding from if you are currently receiving funding from other Compass Initiative Coordinating Centers, you are not eligible for funding through the Faith Coordinating Center. So the other Compass Initiative Coordinating Centers are at the University of Houston, Emory University, and Southern AIDS Coalition. So if you are currently funded by any of them, then you are not eligible to apply for funding here. However, if you've received funding in the past and that funding has ended, then you can apply. And you will be required to provide a narrative report and a budget report at the end of the grant cycle. Okay, so all of this information is the same for the transformative grant. The only difference is that the application for the transformative grant will be open April 19th and it will be due May 21st. And the funding cycle for this grant is a little bit longer. It is 1.5 years rather than 1 year. Also, with the congregational and the faith action grants, you can reapply to renew your funding for another year. So lastly is the capacity building grant. That's the $250,000 level. Only organization, so you have to submit a letter of intent. We did have the letter of intent due March 15th, but we have, since we're doing this funding webinar, we did want to extend that deadline for people for another week for any organizations who are on these webinars who are interested in applying for that larger funding to submit a letter of intent by March 31st. Only those who we have an administrative review of the letters of intent, and we will extend invitations to organizations to submit a full application, and that full application will be due May 1st. So only organizations that receive an invite may apply. And these are for 1 year cycle. We're thinking about organizations that can pick up with $250,000 and run, who already have the infrastructure set up and are able to do that work. Okay, so allowable expenses, and all of this stuff is also outlined on the Compass, GileadCompass.com. When you're looking for these funding opportunities to apply, all of this information is already outlined on the website. So you can use this to pay for program-related costs, including staff, supplies, technology, incentives, and membership fees for required platforms, so like for software. However, you cannot use it for medications or purchasing medications, direct medical expenses. You cannot do it for paying off debt for organizations. You cannot support biomedical research through these funds. You cannot influence or advance Gilead's, or projects that directly influence or advance Gilead's business, including purchasing, utilizing, prescribing, or providing any kind of support for that their products cannot be supported through this funding. So, for example, PrEP, a lot of people are, you know, you can talk about PrEP, you can educate PrEP, but you cannot prescribe PrEP with this funding, right? Individuals, you cannot use the funding to support individual healthcare providers or individuals. You can't give the money directly to individuals. It has to support programming. And it cannot support events or programs that have already occurred or lobbying activities. So in order to your application to be considered complete, you need to submit a W-9. And a reason why we're asking for the W-9 is because the process takes a long time for us to get grantees set up in the Wake Forest University system. So we do kind of want to have some of this documentation available if and when the grantees are selected, so that we can hit the ground running once the funding is released. We would like to see some letters of support, so demonstrating that the organizations that you say you're going to work with have also provided a letter saying, yes, I will work with you on this project if it were to be funded. Your proposal, obviously, and a verification of your 501c3 status or a letter from your fiscal sponsor. And then your current operating budget and the what budget you plan to use, how you're planning to use the grant funding if you're awarded. So the grant budget and the budget narrative. We released the announcement on March 15th. Deadline is May 1st, except for the transformative grant, which is May 21st. We will review the applications through May, except for the transformative grant that will be through June. And we'll send out award letters by June 1st, and funding should be received for all of the grant opportunities by July 1st. All right, so I'm going to stop here and see if we have questions.
We have not had any questions placed in the chat as of yet.
Brittany, I think I see one from Joy Williams. Can you see that one?
Yes, regarding the slide. So
Yes, we will be able to provide the slideshow outside of the recording.
The next question, is there a particular format grant proposal should be submitted in?
So on the Gilead Compass website, if you look for the name of the grant that you are interested in applying for, there is a submission form. And it has questions in there basically you're filling out that form to submit your grant. So what I would do is I suggest that you go look at the form, copy and paste the questions into a Word doc, prepare your responses, and then you can input them into the form. You can also save your responses and go back and work on it over time and provide edits. But I think it's always easier to work in a Word doc where you can kind of edit and share feedback before submitting the final proposal.
Our next question is, with the grant, are we able to operate in more than one state at a time?
Yes, definitely.
It looks like there was confusion around the statement that was made that you can't pay individuals. Would you please clarify exactly what you meant by that?
I think the idea is that, so you can pay, like, if you're doing research, you can pay like a participant compensation, gift cards and that kind of thing. But the idea is that you're not using the funding to pay for healthcare costs for an individual person. If they're doing work for the project, you can pay them as a consultant. If they are participating in the project in some way and you want to compensate them for as a research participant or as a program participant, then you can pay them that way, but it's not for individual healthcare costs.
And can I also add, and I think Dr. Matthews, you said this very clearly, that our focus with Compass is not to fund individuals for individual projects, but is to fund organizations, which is why it's important that you either have a 501c3 or a sponsoring institution that has that status.
So, right. So we're not necessarily going to support the individual salary of one person.
Thank you. Are there any stipulations in terms of remote work due to COVID?
No.
Looks like our next question is, if I'm currently being funded by Gilead Science, will I be able to apply for funding through Wake Forest?
Dr. Jones, do you know the answer to that?
So ideally, you wouldn't be getting multiple sources of grant funding for the same project, right? So if you have a separate and distinct project that involve faith entities or persons of faith, then there's a possibility. But what we're not trying to do is have multiple funding sources from the Compass project for the same effort, if that makes sense. So you may have an organization that's doing multiple programs, but not something specific in faith, but you've imagined something that could be funded through this project. And in that case, I think that would be a strong consideration, but not, we wouldn't want you to sort of double dip and get funded for something that's already being funded through Compass.
So, but there are other initiatives offered through Gilead, like the Focus Initiative and
Yes,
others. And if they receive funding, those have completely different focus areas. So that's not focused on stigma, it's focused on connection to healthcare. So if you have programming like that, that maybe is not a good fit for for Compass, then we may also suggest that you apply for that other funding.
yeah.
Looks like we have one more question. Could I apply to participate in the Learning It Together cohort and apply for the Faith Capacity Building Grant?
The answer for me, Allison, is yes. That I would not see that as being a conflict. And if I think the key is that you are an executive level individual in your organization trying to learn with other executive level individuals who are decision makers in their spaces. So I wouldn't think that you getting a grant would preclude your participation in the learning cohort.
Right, but it does not work. In order to participate in the learning cohort, you're not required to have funding.
That's right. And Brittany, I think we have time for one more question.
Okay, it looks like we have one more final question. If you could please talk more about organizational operating budget. Would this be the church net if a new faith-based network has created a 501c3, but operational budget is still being worked out?
I think that we want to get a sense of, beyond the funding that we provide, do you already have funding available to support your programming beyond the scope of the project? And the idea is to demonstrate that you are able to sustain these programs beyond the scope of the project. So the operating budget, I think if you're an individual church, it would be the church budget.
I think that's all we have.
Dr. Jones, do you have any additional response to that question?
Not really. I think that's right. I think what Dr. Matthews has said is correct, that we're trying to get an idea of, in addition to the monies that you might potentially get from our initiative, what are the other resources that that you have access to? And if your particular entity is operating within a church, you can submit both budgets. The idea is that we want information just to create a full picture. So whatever that looks like in terms of you putting your best foot forward with the application is what I would suggest that you do. So I want you to hear, and I think Dr. Matthews said this very clearly, that we want to fund projects and we want to make sure that we are inviting you to creative, innovative work in the South, and that we have these resources, and we will consider you to be our partners in this work. And so that you would utilize us and the Faith Coordinating Center as a resource moving forward with the grants, but with other opportunities as well.
Dr. Matthews, it does look like we have one question in the chat. What is the determining factors for those who are considered at risk of acquiring HIV?
Can you repeat that question one more time?
Yes. What is the determining factors for those who are considered at risk of acquiring HIV?
So that is kind of, okay. So the people who are most at risk, and this is mostly based on epidemiology and research, but we know that men who have sex with men are at high risk. Transgender men and women are at high risk. Black women and Black men, regardless of your sexuality, are at high risk for acquiring HIV. People who are low income, people who are housing insecure, food insecure, people who have limited access to healthcare. These are the types of people who inject drugs, yes, or who, yeah. So these are the types of, or people who are in relationship with people living with HIV, people who engage in sex work. So those are the category. Those are the typical people who we would consider vulnerable to HIV. However, that does not preclude anyone else from also acquiring HIV.
Looks like we have one more question. Can more than one grant from the Faith Coordinating Center be applied for and run at the same time during this grant cycle? As I know that from other coordinating centers that this is not allowed.
No, you should only apply for one grant at a time. So please select the one that you think is most appropriate for you. And you can also inquire and see, if you want to ask more specifics from one of us, giving us like some more detail about what you're proposing, and then we can kind of see which one might be a better fit for you.
There aren't any additional questions in the chat at this time.
Well, we certainly appreciate everyone for joining today. If you have additional questions, you can contact our program administrator, Marcus Holly. So Marcus is putting his contact information in the chat. It's compass@wfu.edu. And you can call him 336-758-5058. You can submit, and we also kind of encourage you to go to gileadcompass.com to look at the application, kind of prepare your materials separately and then submit. You have to, it's an online form, so you just copying and pasting your information into that online form. I see there was another question.
Yes, there is one more question. Will you only get consulting if you are approved for the grant?
We're only providing financial support for consulting if you're approved for the grant, but if you have you need some general support, we're always open to meeting with people and talking through things with them and providing advice. And if you're also, if your proposal is not funded, but maybe we think it's maybe a good fit for another funding opportunity that's provided by Gilead, we certainly would provide that suggestion to you. There are plenty of other funding opportunities. We are not the only one that's offered through Gilead. They have others that are more focused on that healthcare focus. So say you're a healthcare focused organization, and you really want to focus on the healthcare costs and offsetting costs for medications and those kinds of, there are funding opportunities through Gilead for those things. We are just not offering them through the Faith Coordinating Center.
And if you could just reiterate when the recording and the slides will be made available to attendees.
Yeah, so the recording should be available by tomorrow, I believe. It didn't take us long for it to get it up on the website. And we will also upload those slides. And we're also going to be sending out the recording via email, because there are some people who registered who were not able to attend. Thank you so much, everyone, for attending. We look forward to your applications, and feel free to reach out to us if you have additional questions. Have a good day. Thank you.